Next is contracting, which is co-chaired by Dan Upton and Kieran Cody. So Kieran, you got 6 minutes.
This is another nuts and bolts committee. This is not a clinical committee. We're at the contracting. So why are we here? So you've heard this before. What's DHP about? Well, if we follow the triple aim of healthcare, if we look at all of our decisions, each one individually, and hold it up to these three ideals, we'll succeed. So the goal is to succeed. So we want to improve the quality of care. That's easy. Everybody in this room is going to agree that quality of care is important. We want to improve the patient and family experience. That's what's going to make us special. I think Doylestown community is a special place, but and patients do know it, and we want them to know it, and that's going to sustain us. If they say, wow, this is a great place, they're going to tell their friends, they're going to come back. That's a very important part of our mission. And our final thing is lowering costs to improve efficiency. That's where we get into financial success. Financial success is obviously critical to what we do. Why contracting? Well, again, financial success is critical to program success. If we don't have income, we're not going to have a sustained program. This is a for-profit entity. We're here to succeed, and if we're going to succeed clinically, we have to succeed financially. So, contracting committee has had a few highlights in our brief existence. We have 4 contracts and a few more in the works. 2 of these contracts have been signed and are actually in existence. So the Doylestown Health Associates contract will go into effect July 1. This contract is signed and will go into effect. This is an upside-only contract. There is no downside to this. It has 2 components. There's a pharmacy bucket and a professional services bucket. The pharmacy bucket, every dollar we save as a group of physicians, DHP will get 50 cents. That goes into profit for DHP. That's from day one. The professional services, we still get paid the same amount that we do, but for every dollar we save, there's a 2% collar. So the hospital keeps the first 2% of savings, and beyond that, we split the savings 50-50. It's a pure upside. The goal of the hospital is to reduce care that's given outside the doors of the hospital. For instance, if the hospital has an associate who goes to Abington, they have to pay the bill. If the associate's taken care of at Doylestown, it's essentially considered no cost. So every patient that we have and don't send to Abington and take care of at home, that's 100% savings for this contract. So the upside could be substantial, and that's going to fuel our organization. The other contract that we have signed and will go into effect July 1st, it's a very small contract right now because Humana is not a big player in our market, but Humana is committed to becoming a big player. They're committed to advertising and marketing. This is a tiered contract that will go into effect as their number of covered lives gets bigger. It's upside risk only until the number of membered lives justifies the risk, and that's 1,000 covered lives. This is only Medicare Advantage plans. The fee-for-service side of this is paid at 102% of Medicare to the physicians in this room. The hospital, it's 100% of Medicare. There is a care coordination fee for the primary care physicians of $4 per member per month. There's also a reward program, again, for primary care, involving 5 HIDUS measures and 4 Humana measures that could add potentially $4 per member per month. That's initially. So if the number of covered lives is greater than 1,000 HMO lives, then we're going to go into a shared risk program. The shared risk program is really where there's greater upside. And with this Humana contract, I think it's very interesting because they will judge our shared risk against the collected dollars for premium. It's not against our performance the previous year. Some contracts go against our previous performance, which is always hard because if you perform well, they keep ratcheting it down. But this is against collected premium, which will always stay the same. So that's very good. Tandem and Aetna contracts are in the works. I don't have any details, but they're in discussions, and we also have discussions going on with United Health and Cigna. So remember, healing is an art, medicine is a profession, but healthcare is a business, and without successful contracting, we don't have a successful business. Thank you.